Hi, I'm Dr. Daniela Steyn, and today I'd love to chat with you about hyponatremia in endurance athletes. I've received a lot of questions from a lot of you. Thank you so much for the questions that you've been sending me. So after my Ironman race from last weekend, I mentioned that I replaced my electrolytes. And then a question that I got was which electrolytes, how much, when. And then I'm working tonight at the hospital and I'm on call, and one of the patients that I got called for tonight was specifically regarding hyponatremia. So I thought, this is a good place to start. Hyponatremia is when the salt level in your blood is too low. So you're in hospital, it typically gets caused as a side effect from other medication, maybe a diuretic, a type of blood pressure medication, or maybe a side effect from an antidepressant. In hospital, we correct it different ways. Sometimes we give intravenous salt replacement. Sometimes we just tell the patient not to drink any water and restrict water intake. Sometimes we give salt tablets. But whatever we do, we monitor it very closely. For the patient I saw tonight, I'm going to continue to monitor this patient's blood work every 4 hours. Because if we replace the salt too quickly, that can be harmful as well. So, but then specifically for you, why you need to replace salt is if you are one of my fellow triathlon athletes or an endurance runner, when we run, we sweat out a lot of salt. And if we drink only water, we're only replacing water and we're not replacing the other electrolytes. Just on the short term, it can cause you cramping while you're swimming, but then on the longer run, it can be very harmful and it can literally cause death. So it's so important to prevent it. And there's different ways to prevent it. During my World Championships 2 weeks ago, that was a shorter event. So what I did was before my race, I had eggs for breakfast and I just put a lot of salt on that. Then for a longer event, such as the Ironman Muskoka, which I did last weekend, you can't eat enough salt while you're running, because it will just make you nauseous. So what I do then is to take a salt tablet. The brand I use, because a lot of you ask me, what do I use? The brand I use is Salt Stick. But I recommend, because I saw some of the people who ask me are from Europe, from different countries, I recommend you find something local. You don't have to import this specific tablet. I like Salt Stick because it has sodium, potassium, calcium, and magnesium in it. But you can use any brand, and that is specifically for your longer races, for endurance races. For shorter races, you can very likely replace it by what you're eating, taking a calcium and magnesium supplement the night before, and just salt in the morning on top of your food. That being said, my friends who are not athletes, don't start adding extra salt to your food, because that is something on its own. At my wellness clinic, I treat patients who have a higher blood pressure and who try to manage their blood pressure naturally. I actually have a video on that. I'll put a link in the description, a YouTube video on how to manage your blood pressure, how to lower your blood pressure naturally. And in that video, I mentioned the first thing that you should do is to stop eating salt. But then typically with the triathlon athletes that I've been working with, especially the ones that are on my nutrition program, really like to make their own foods, fresh foods, healthy foods. So they do not at baseline use processed foods. Processed is anything that gets made in a factory, any fast foods. Those ones usually have a lot of salt in them, lots of hidden salts, extra salts. But then typically, to generalize, typically the triathlon athletes that I work with don't have any salt in their diet. So they would be at a higher risk of developing hyponatremia, electrolyte deficiencies. So that's one thing. If you notice that you cramp easily while swimming, first it could be dehydration. If it's not dehydration, look at your electrolytes. And then if you do any form of endurance event, make sure that you don't only drink clean water, but that you replace your electrolytes. Please leave your comments below and ask me if there is anything else you would like to know more about. Take care.